To the Senator from Colorado.
Madam President,
Senator from Colorado.
let me start by thanking my colleague, the Senator from Oregon, for holding this important gathering here on the floor of the Senate this morning. Madam President, my fellow freshmen have stressed that health insurance reform is essential in helping us lower spending, chip away at our federal deficit, and strengthen our economy. While the reform proposals before us would contain costs across the board, I'd like to focus on a particular area of health care reform near and dear to nearly 45 million Americans, and that's Medicare. Reforming how we pay for Medicare and how we spend those valuable taxpayer dollars is one of the biggest cost-containing tools that we can include in health care reform, and it will also, Madam President, improve the health of seniors. Now, Coloradans have rightly asked me and Senator Bennet how health reform can reduce government spending on Medicare while at the same time strengthening benefits and improving their health. They want to know how we can be getting more as the government spends less. The answer is that health care reform can make our government and us smarter consumers, because right now 30 to 50% of spending on health care does not make a patient healthier. That's a lot of room for savings, Mr. President. Mr. President, let me give you an example. Today, Medicare actually pays doctors and hospitals more to amputate a leg than it does to treat early diabetes and actually prevent that amputation. Our government should be paying for quality outcomes, not writing checks that encourage expensive care that could have been prevented in the first place. So let me give you a couple of examples of how reform can change these incentives, help improve care for our seniors, and also decrease costs for all of us taxpayers. First, reform can lower the rate of unnecessary hospital readmissions. Right now, one quarter of all Medicare patients who are discharged from the hospital end up going back into that hospital. Health reform would reward hospitals like St. Mary's in Grand Junction, which coordinates care and follow-up to ensure that patients don't end up back in the hospital. Second, reform can hold hospitals accountable if they're not doing enough to reduce the number of patients who develop infections in their hospital. Such infections cause seniors to stay in the hospital longer, cost tens of thousands of additional dollars to treat, and in the worst cases are life-threatening. Health care reform would also invest in and encourage innovative ways to deliver more efficient care to seniors. So-called patient-centered care can prevent seniors from being admitted to the hospital in the first place. You'd notice a theme here, Mr. President, I think I'm carrying it, and all the freshmen have here this morning, which is that the government would be paying less under a reform package and the seniors would be healthier for it. Now, Mr. President, I haven't even touched on the billions of dollars per year in waste, fraud, and abuse that reform will help wring out of the system. I also haven't discussed the new cost-effective, tough controlling mechanisms like a new Medicare payment advisory body to ensure that Medicare dollars are being spent efficiently to improve patient care and balance our federal checkbook. The reforms we are considering, Mr. President, are critical to changing the way that the government pays for Medicare so that we can ensure the long-term sustainability of it. And the reality is, if we don't act, as was mentioned earlier this morning, if we keep spending like we do today, Medicare will be bankrupt by 2017, just 8 years from now. That's a sobering thought. If we take the step to reform our health care system, it will have the immediate effect of extending the life of our Medicare trust fund for 5 more years, and at the same time, we will lay down a foundation that will keep costs down in the long term so that we can make Medicare sustainable for generations to come. Mr. President, I yield the floor.